Are you looking to increase the awareness and reputation of your healthcare product or device or app or whatever it might be? Are you wanting to perhaps elevate the status and standing of your product, healthcare product or device, in order ultimately to secure more leads and more sales? Well, if you are, one key way to think about doing this is expert opinion. And I'm going to presume here that let's say your target audience are clinicians and other healthcare professionals. The consumers is a different ball game entirely, but let's presume it's healthcare professionals and clinicians across the board, doctors, nurses, occupational therapists, let's say. Let's just give an example. Let's say you might have a particular hygiene product or device, and you are ultimately wanting to grow the business, and you're looking to raise awareness and raise the profile of your particular hygiene product. Now, one key way to think about doing this is positioning, because someone within your company is going to know more about this particular area, hygiene in hospitals for example, than anyone else. So it's about making sure that that person is the avenue, is the medium by which to position your company and hence your product as a leading light in hygiene around hospitals, for example. So you'll have to be thinking about how you can pitch that individual to write expert opinion pieces for particular media, again, whether that be media read by nurses, whether that be media read by GPs or hospital doctors, or perhaps even commissioners, or occupational therapists or physiotherapists or care providers, whatever the target audience is. But expert opinion is the way to do that, because what you are doing is positioning your spokesperson, your CEO, your clinician within your healthcare company, whoever that might be, as a national expert around, in this case, hygiene in hospitals. And expert opinion is the key way to do it. And the key to expert opinion is knowing as much about the media which you're targeting as well as the product. So let's give an example here, the Nursing Times. If you were looking to be featured in the Nursing Times, or certainly online, it doesn't exist as a magazine anymore, then it's a matter of making sure that you find that individual within the Nursing Times, the commissioning editor, who is responsible for commissioning expert opinion pieces, and then approaching that person, initially via email and following up by phone, to accept you to write an expert opinion piece on, for example, hygiene in hospitals. And thinking off the cuff here, again, it could be the 10 latest developments on hygiene in hospitals. Something as simple as that. I'm not saying in this case it would be something as simple as that, but a strong pitch, and that would be pitched to that commissioning editor at the Nursing Times, and then he or she would say yes or no, ideally the yes, as long as your pitch is strong. And that's a way to start positioning yourself as an expert to that target audience, and that expert opinion piece can then be used in a whole different and of course that expert opinion piece, which has been commissioned and used by, let's say, the Nursing Times, can then be used in other PR and marketing mediums in order to ultimately raise the profile and position of your healthcare company. So I hope that helps.